Today we are going to give the spinal anesthesia for a low cardiac patient. And the patient
না না আমি করলে ক্ষতি হবে ডাক্তার যেমন কোনোদিন আরেকবার বলুন হবো না আমার ফেরিবারও নাই জামাইটা
today we are going to show you a spinal anesthesia for low cardiac disease patient. In this patient, he has ejection fraction of 40%. So we are going to show you how we give spinal anesthesia for this patient, and this patient is going for lower limb surgery. So we are now ready for wash the patient from his back for the sterilization purpose. This is our acidified alcohol solution. This is our black sheet and the back of the patient. Okay. Now we are going to take the surgical film. This surgery will run for 3 hours approximate. So we are going to give a large volume of bupivacaine in this patient. We are taking 3 ml of bupivacaine and 0.5 ml of fentanyl. Then we are taking local anesthetic agent, lidocaine 2% for numbness of the skin. Okay. We are going to take baby needle. This is actually 25 gauge needle. We are finding the space of the spine. Finding the space of the spine.
আরাম করে বসুন ছেলেটা কাট ছেলেটা
We are slightly waiting for 1 minute. Okay, we have completed 1 minute, and now we are going to introduce our spinal king needle, which is 25G. Okay, we got the pop fitting, and we are seeing the CSF is coming out of the needle. Okay, then we connect the series with the hub of the needle, and pushing forward very slowly. We are pushing our drug, which is very simple actually. Now we will wait for 30 seconds for the settlement of the drugs. Pause. Okay, the patient is then positioned in supine position, and we are going to observe the blood pressure right here. Yes, we are seeing his initial BP 203/88 with a huge gap in the pulse pressure, and we thought that it will reduce in after some minutes, but it is our target to overcome the relative volume deficit with the normal saline or any other isotonic crystalloid fluid. So we are giving some boluses. We set up our ECG lead, and NIBP also inflating its cuff. We set the NIBP interval period of 3 minutes for this patient, and we are expecting some reduction in blood pressure, especially the systolic pressure now in this time, in this inflation, in this measurement. So after we are getting, when we understand that, after we observe the reduction of blood pressure, we will, if it reduces too much low, less than systolic, less than mean pressure of 70 or 60, we are going to give the vasopressor as ephedrine. Yeah, ephedrine is in our hand, but we are observing that it is not highly reduction of blood pressure. The mean blood pressure is 100 and systolic is 157 by 70, so it is in our range and we are completely okay. So we are seeing that we are giving the 3.5 ml of total 3.5 ml of volume in the CSF space and not having a huge depletion of blood pressure. Okay, now we are going to give ondansetron 8 mg for the reduction of emesis, nausea, vomiting for this patient, because due to reduction of the blood pressure from very high to low, this may cause the nausea, which will actually deteriorate the experience of the operation for the patient, as the patient is already agitated due to lack of communication and education of the operation. And I think if we practically do this, give this ondansetron injection, this will causes the reduced chance of emesis and will improve the total experience of the patient. And we are getting the second blood pressure measurement, and it is 154/68. Mean pressure is 98, and we are totally okay with the ECG tracing and pulse oximeter waveform. Okay, hello friends. As the heart rate is not reducing with the time, so we are thinking that our blood pressure is due to high blood pressure is due to this high blood heart rate. So we are going to reduce the blood pressure as well as at the time of increasing the vessel tone. So we are giving some vasopressor. We are going to give ephedrine for increasing venous resistance or arterial vessel resistance. We also know that ephedrine is indirectly acting drug, vasopressin drug, which have some effect on the heart. It will increase the heart rate, but definitely we are going to give it in a very low dose to reduce this action on the heart. Now we are going to give only 1 ml of ephedrine for the patient, which is 5 mg of ephedrine, which will slightly increase the vessel tone or vessel resistance, but not highly increase the heart rate. Okay, welcome back friends. We are seeing that we are having our blood pressure 202/80, mean pressure of 115. It is 3 hours after the last measurement, but heart rate was slightly around 115 to 120. So after giving 1 ml of ephedrine, it is almost similar, but increasing with the increase of vessel resistance, the blood pressure rises. So we are hoping that this heart rate is set up by the sinus of the patient, so it will not increase or decrease with the vessel pressure. So we are not trying to we are not going to change the heart rate for the patient, because it is set by his sinus. After giving the vasopressor, we easily understand this thing, so we are not going to modulate it. And now we are having the blood pressure of 168/72, which is pretty good, I think. Somehow I have a thought for sedation of the patient or spinal anesthesia, but patient is not fully agitated. He is calm and quiet right now, so we are not going to give any sedation right now. If he is agitated after some time, we will go for a sedation. Hello friends, welcome back after 10 minutes. We are seeing that now blood pressure is 146/67, mean pressure of 97. and it is pretty much equal to the previous value, but you can see the situation diastolic pressure are reduced, but maybe this is the normal stage, which is as the before. But due to decrease of systolic and diastolic pressure, we may think that there is maybe a patient is a diabetic patient also, and maybe he has some autonomic neuropathy. So there is a slow decrease or reduction of blood pressure in this case happened. So we are now alert for further reduction of the blood pressure, and we had prepared our ephedrine for this purposes for vasopressing. But as the surgery is in the lower limb and it is a vascular surgery, so we want to be more cautious for the bleeding, because when the vessel is involved there may be more bleeding when the surgeon incises the vessels. So we will observe the situation carefully and prepare our drug and administer our drug accordingly the situation. Welcome back, my friends. It is almost 35 minutes of giving spinal anesthesia, and there is no huge reduction of blood pressure, and we are seeing the mean blood pressure of 107 right now, and heart rate is 110 with a saturation of 96. So we are not expecting further reduction of blood pressure, mean blood pressure, unless also there is a huge bleeding, and there is actually very little or reduced action of spinal anesthesia on this patient who has a low cardiac reserve, patient 40%. And what we are doing actually, we are giving the buivac in the lower space and trying to get it settled down for some time, which we do in saddle anesthesia, and it causes the less involvement of the thoracolumbar outflow. So as these drugs involving just lumbar outflow of the lumbar sympathetic outflow roots or lumbar roots of the nerve, so it causes little reduction of blood pressure. If it involves the thoracic outflow, thoracic sympathetic outflow, it may reduce the blood pressure heavily, which may happen when we do the upper or lower abdominal surgery. We trying to block the lower thoracic or upper thoracic level, and this causes a huge reduction of blood pressure. But in this case, as the surgery is in the lower limbs, we just try to block the lumbar outflows. It causes the very low reduction of blood pressure and increases the safety of the patient with the saddle approach, saddling the drug in the lower spaces, and with a huge bolus. So thank you for today, and we can understand how we give a huge volume or huge amount of bupivacaine for the low cardiac reserve patient. And thank you.